Hey everyone! Imagine walking into your therapist's office and ready to spill your heart out. But wait, did you know there's a do not say list? Therapy is like a dance. It takes two to tango. And there are some steps you should not take. While it's crucial to be open and honest with your therapist, there are some things that can actually hinder your progress in therapy. In this video, we will talk about 3 things that you should try to keep off the table in therapy in order to make your sessions as effective as possible. Number 1, faking your current situation and telling the therapist that you're doing better than you actually are. This may be because maybe you're ashamed to share with your therapist about some difficult things in your life. Or some people might just try to end the session sooner in order not to work on the goals that they've been told to do by the therapist. And instead, they claim that they're doing well. I've had this happen to me many times. I've had a patient who once told me that they were complying with their medications and they're doing better and they're utilizing all the skills that we talked about. Only to find out weeks later that this patient was actually in the hospital and he had not been doing well for months. Therapy is a judgment-free zone, and the therapist is supposed to meet you where you're at and help you move forward with your goals. So even if you've forgotten to take your medications or you've not been able to implement some of the skills you learned in therapy, it is okay. We are all human. We make mistakes, we forget, time and time again. But it is important for you to be open and honest with your therapist. Not telling the truth will only hurt you and it will push you further away from achieving your goals. So please try to be open. And if you don't feel comfortable sharing some things, talk to your therapist. It does take time to build trust and rapport with your therapist. And if you feel like the sessions are not helping or the sessions are not relatable, please discuss this with your therapist. It might just be time to switch course and to try a different therapy method. So let them know what you are struggling with so that they can help you and they can adapt the therapy sessions to best suit your needs. Number 2, lying about your current situation or not providing the full depth of your symptoms. Maybe acting very superficial or just minimizing how you feel. Remember, the therapist cannot read your mind. The more you tell them, the more they're able to help you and work with you to gain insight into your specific situations. And yes, therapy can be stressful. And yes, it entails sharing a lot of information about yourself with someone that you don't really know. And frankly, you're sharing things that you probably don't share with anyone else. So it is difficult and it can be stressful. And sometimes people worry that the therapist might judge them or they might not even want to work with them after they share all these things with them. So it's really important to know that almost everything you share with the therapist is confidential, which means that legally the therapist is not supposed to share this information with anyone, and it can put them at risk of losing their license if they do so. So this means that you can be honest and truthful with your therapist. And if you're new to my channel, I am Gael, a licensed psychiatric nurse practitioner, and on this channel I talk about all things mental health, like dealing with anxiety, depression, overcoming your fears, personal growth, and family life. So please subscribe to this channel and join our community. And number 3, pretending to be worse than you actually are. Are you reporting no change or improvement when you meet every time with your therapist? Or are you finding ways of prolonging the session? While this might mean that yes, you really enjoy the sessions and you're getting benefit from it, it also can make your progress to be stagnant. It is best that once you achieve your goals, it is time to set new goals so you can keep learning and growing through the process. But saying that you're not doing very well can make the therapist think that you might actually benefit from a higher level of care, such as maybe a partial hospitalization program where you have daily therapy. So instead of doing these 3 things we mentioned above, it is important that you share as much as possible. And if possible, share everything with your therapist. And remember, it is a 2-way process. Be open to share how you truly feel so that the therapist can work hard to suggest resources and different tips that you can use to help you to deal with the stressor in your life. So again, the goal of therapy is to be unbiased, non-judgmental, and provide professional support to you. so that you can gain more insight into your stressor or into your current situation. But before we end, let's talk about some things that are very important for you to share with your therapist. Number one, any kind of abuse. It is very hard sometimes sharing things like this, abuse, especially from a loved one. But always remember that it is the obligation of the therapist to keep most of the information that you share with them confidential. And it is vital for you to share this information to prevent further abuse, especially when it's abuse to a child, like a minor, to an elderly person, or to people that are dependent. Number two, sharing any thoughts of suicide. I understand that it is really scary to even have these thoughts, and even more difficult to share these thoughts with anyone. And yes, the therapist might sometimes need to discuss this information with someone else, but that's only if you are in immediate danger. But first, before we do that, we always take a few steps. We always assess your risk level first. And by doing so, we might ask you for maybe a family member or a friend for their contact information so that we might reach out to them in case we cannot reach you, just so that we might do a wellness check on you. That is usually the first step. And in case we cannot do that, or if we cannot reach that person, if we feel that you're still in imminent danger, we might recommend you to go to the nearest hospital. And yes, this is even scary too, but it is for your own good. And even though most of us do not like to go to the hospital, it might be a safe place for you to get support and to talk to someone about these thoughts you are having. And yes, we healthcare professionals are sometimes mandated to report some things such as abuse. But my friends, it is always for your own good. And I know that finding the right therapist might be difficult, and building trust and rapport might also take time, but it is truly worth it. And from my experience, there are many providers and there are many therapists out there who truly care and who truly want to help you through this process. So please do not give up. Reach out to a therapist. Talk to someone about how you feel so that they can help you. They can meet you where you are and help you in achieving your goal. Thank you again for watching this video. Please like this video and subscribe to our channel.